Hi, today we will talk about Wellbutrin. Generic name is bupropion. We will talk about medication effect, why we use Wellbutrin, what is the cost of the Wellbutrin, and what is unique about Wellbutrin. My name is Dr. Kadir. I am a board certified psychiatrist in the state of California. So let's talk about Wellbutrin. Wellbutrin is a brand name of a medication. Generic name is bupropion. Mechanism of action of Wellbutrin is unique. It is not like a typical SSRIs which only works on serotonin. Wellbutrin works on dopamine and norepinephrine both. It is also works a little faster than a typical selective serotonin reuptake inhibitor. So what is the use of Wellbutrin? FDA has approved Wellbutrin for major depressive disorder. It is also used in people with sexual side effects, and there are a lot of other indications like bipolar depression, which is non-FDA indication. It is also used in people with ADHD and also used in people off-label for people who are using selective serotonin reuptake inhibitors like Prozac, Paxil, Zoloft, and they have sexual side effects. So we use Wellbutrin quite a bit in those kind of patients also. What kind of dosage forms Wellbutrin comes in? It comes in three different forms. One is regular Wellbutrin, one is Wellbutrin SR, and one is Wellbutrin extended release, which we call XL. The regular Wellbutrin comes in 75 milligram tablets and 100 milligram tablets. Wellbutrin SR comes in 100 milligram, 150 milligram, and 200 milligram form. Extended release Wellbutrin comes in 150 and 300 milligram form. How do we dose these medication? Wellbutrin is mostly used these days in extended release form, in an XL form. Some people still use in sustained release like SR form. I rarely see people using regular Wellbutrin. Regular Wellbutrin usually is being used 3 times a day. Sustained release has been used 12 hours apart. But because Wellbutrin can be activating, so even sustained release people use it, let's say 8 in the morning and around 1 to 2 p.m. Extended release is, in my experience, is a better form of medication because we only have to use it once a day. People use it in the morning time. So mostly I see people using the extended release. Unless and until people are sensitive to medication, sometimes we use regular Wellbutrin. So let's say a person is being used, has been tried at Wellbutrin XL 150 milligram, but the person is very sensitive to medication. So then we start at regular dose like 75 milligram or 100 milligram, and then gradually move it to extended release 150 milligram dose. So what is the pricing? Wellbutrin is a generic medication. It is approved by all the insurance companies. If someone has to pay cash, Walmart carry it for like $15 for 30 tablets of 150 milligram of Wellbutrin. Like any antidepressant, Wellbutrin does have side effects. The main side effects is activation. So because it works on the dopamine receptor, it does activate some people. So whenever a person starts Wellbutrin, you might notice that activation side effects or increased energy or restlessness, usually it goes away. If someone has anxiety disorder, sometimes that side effect can be very bothersome. So that's why if you have anxiety and depression both, and if you are taking Wellbutrin, if it's causing you to get too anxious, too restless, talk to your doctor. Maybe either they have to cut down the dose or maybe they have to try a different medication. Usually I see also dry mouth, headaches also can be caused, and sometimes people complain about tremors. Sometimes people also have nausea and stomach upset. Also because Wellbutrin is an activating medication, so if you take it too late during the daytime, it can cause problems with sleep. So people usually take it during the daytime. I've also seen some percentage of population that even when they take it in the morning, they feel more tired. So I have very few people who take it at night time, but it's very rare. It does have one very rare side effect. It's a side effect of seizure. It's very rare, but if someone has a history of seizure disorder and if they are on medication for seizure disorder, it's better not to take this medication, or you have to be very careful. Another rare side effect is there was some research in people who had eating disorder, anorexia, and they had seizure when they were taking Wellbutrin. So if someone has active anorexic symptoms, so it's better not to take that medication. What are the side effects when you stop Wellbutrin? It does have withdrawal side effects like nausea, stomach upset, restlessness, anxiety, but it does not have as much of withdrawal or discontinuation syndrome as other SSRIs are. So what to do if you have to switch Wellbutrin to a different medications? Always try to taper down Wellbutrin at the same time increasing the other medication. If you have to start Wellbutrin, and if you are on, let's say, another SSRIs, the same thing, cut down the first medication and then increase the Wellbutrin. Sometimes we use Wellbutrin along with another medication. What happens, let's say if someone is on SSRI like Prozac, Paxil, and they are noticing that the depression is getting better, but the side effects are there. Let's say they have sexual side effects and they are feeling, hey, this medication is working, but I'm having this sexual side effect. So what they can do, after talking to the doctor, they either cut down their SSRIs dose, or they add the Wellbutrin for that sexual side effect. So that's one use of Wellbutrin, which is very unique to Wellbutrin. The other thing is, let's say if someone is having problems with low energy, low motivation, they have focus problems, so Wellbutrin is a good medication. The other good thing about Wellbutrin is it is also used for people who have ADHD and depression both. It is not a very robust ADHD medication, but I've seen in people it does help with energy, with the focus. So someone, if they have comorbid both like depression and ADHD symptoms, so Wellbutrin is a good medication. The other thing is Wellbutrin usually does not cause weight gain. So if someone is having side effects like weight gain with some medication, Wellbutrin is a good medication to try that. The other thing about Wellbutrin, it's also used for people who quit smoking, and it is being FDA approved for that. FDA has approved for SR, the sustained release preparation of Wellbutrin for that. So it's a good medication. Usually for smoking cessation, people use it between the dose of 150 to 150 twice a day. Wellbutrin is also being tolerated fairly well in people with bipolar depression. Again, if you use any medication with people with bipolar disorder, and if you are using it for depression, always make sure that some mood stabilizer is on board, because any antidepressant, including Wellbutrin, can switch a bipolar depressed person to mania. So in my experience, Wellbutrin is a fairly well tolerated medication. It is readily available. It works also faster than other antidepressant, does not have that much side effects, but people with anxiety have to be careful because it can increase the anxiety symptoms in some people. So that's why you have to be careful with that. Otherwise, it's a fairly good medication, especially in people with depression, ADHD, and it is smoking cigarettes. Thank you very much for watching the video. Please let us know if you would like us to create another video on any topic. Please don't forget to subscribe to the channel. Also let us know what you think in the comment section below. Thank you.